Hi future dentist, welcome to the new session of general medicine. Today we are going to see about case history discussion and the clinical examination. So this part is very important for your clinical sessions. So let's begin. What is the importance of case history taking? So case history is a technique of taking the information that is relevant to the medical history of the patient. So it is very important to have a proper diagnosis, to reach a proper treatment plan and understand the underlying causes also. It is a process by which the information is gained by a physician by asking specific questions to the patient with the aim of obtaining information useful in formulating the diagnosis and the medical care to the patient. So, as the importance of case history taking helps to detect you to reach a proper diagnosis of the conditions too. The importance are obtaining an accurate history is a critical first step in determining the etiology of a patient's illness. So, the diagnosis is a medicine is based on the clinical history, physical examination and the investigation. So, before concluding the diagnosis, we have to have a proper clinical history, the physical examination has to be done properly and the investigation has to be done accurately. Next, we'll see about the components of history taking. The first, the patient profile, the chief complaint, history of present illness, past medical history, the family history, socio-economic history, and the system review. First, we'll see about the patient profile. So, in the patient profile, the initial questions what we are going to ask, like the name of the patient, the age, the sex, from which religion, that is not that much important, but some conditions are basically seen in certain religions alone. So, the marital status, the occupation, address, all comes in the patient's profile. So next we'll see about the chief complaint. So chief complaint has to be recorded only with the patient's words alone. There should not be any medical words in the chief complaint. Number one. Number two, you should understand is that whenever you write a chief complaint, always include the duration. That is, if the patient is having a fever from last 2 days, when you record the chief complaint, you have to include the days or the duration of the disease too. Next, about the history of present illness. History of present illness means it is an elaborated form of the chief complaint. That is, chief complaint should be very small and accurate. That is, a patient is having fever from past 2 days. That is a chief complaint. So coming to the history of present illness, what you should include here is that you have to elaborate the questions of having the fever, that is how he had it, from when he had it, did he have any aggravating factors, did he have any relieving factors, is he associated with any other symptoms, that is he is having fever, is it associated with cough, body pain, headache. These all should be included in the history of present illness. So there you can use medical words, that is up to you. So that is the elaborated form of the chief complaint. So the questions which you should include here is site, onset, character, radiation, elevating factors, timing, exacerbating factors and severity. So if a patient is having pain over the left upper tooth region, that is the chief complaint. So your question related to the pain should be, where is the accurate site, the spot where the patient having the pain, you have to include in your history of present illness. The onset, from when he is having the pain, from last 2 days, from 1 month, that has to be included. The character, so some may say that it is like a sharp pain, it can be a dull pain, it is it will just remain for 2 minutes or 2 seconds. So different types of different type of description may be there for the pain. So that is a character. So radiation means if the patient is saying that when I'm having a toothache, I'm having a pain over my ear also, otherwise over my neck also, that is a radiating pain. So that has to be included. Then the elevating factors means sometimes some patients can say that whenever I'm having food, the pain is increasing. So that is the elevating factor. Timing, I'm having pain only at the morning hours or at the night. That is the timing. That is, we have to be specific at what time the pain is having. Exacerbating factors means any situation that can worsen the condition. That is, some can say that whenever I'm having hot water, the pain aggravates. Whenever I'm having ice cream, the pain increases. So that is the aggravating factors. Then the severity. Severity means Some can say that I'm not able to withstand the pain, I'm not able to control the pain, I sometimes some can even lose the consciousness too. So that is the basis of the severity. So these are the questions you should include in your history of present illness. Next, about the past medical history. So the importance of past medical history is that when you're going to treat a patient, you should know the patient is having any sort of medical history. For example, if I'm going to do an extraction of a patient, if I'm not asking any relevant history of his medical system, that is, if if he's having any medical compromised conditions, I'm going to directly do the extraction. The bleeding is not stopping, and as soon as the bleeding is not stopping, the patient, otherwise a bystander, may say that he is on a clopidogrel, otherwise he is an diabetic patient. So the healing, the extraction, everything is going to be different, right? So always have a proper medical history record. Without a proper record, never touch the patient, never do any procedures. About the family history. So the importance of family history, that sometimes the patient can say that he is not having any problem at all, he is not having any symptoms, his complete health is okay, his checkups are all fine. He might say that. Some patients, like, they can even hide the relevant histories. That is also very common nowadays. So whenever you ask about your family history, sometimes he can say that by like, for example, my mother is being diabetic for past 20 years or 5 years or anything like that. So when a patient says like that, or his father had a recent he had a death due to some conditions like hypertension or renal problems or something like that, it is understood that we have to have a checkup or an investigation over the patient whether he is having or not. So it is just a rule outing. If he is not having, that is okay, fine. Then if at all, if there is any sort of conditions remaining in him, we have to treat accordingly. So always family history is very much important to ask. Socioeconomic history means sometimes a patient might have some type of habits like alcoholism, smoking and all. So if you're going to do any type of treatment, for example a dental treatment, that is an extraction, and if the patient is going to have his smoking habits, continuing his smoking habit, means the extraction site is not going to heal properly, right? So in order to have a proper healing, the post-operative measures, we have to have the habit importance is also very, it has to be recorded properly. And any sort of drug intake, that has to be also recorded, because whenever we are giving any medication, the drugs which they are consuming already might not go for a cross-linking reaction. Next, we'll see about the physical examination. So physical examination, generally what we do is that we'll see the patient's overall features, that is the posture, the way he speaks, that is he is well oriented or not, is he replying properly, he's conscious, everything comes under physical examination. Next, about the vitals. So vital recording is also very important. So in that, the first one comes the pulse. We have to record the pulse, the blood pressure, the temperature, weight, the respiratory rate. All these all have to be included in the vitals. You can also include if the patient is having any sort of cyanosis, clubbing, icterus. Icterus is if the patient is having jaundice. You can also record it in the physical examination. Then we'll see about the system review. So in system review, the general features, that is whether the patient is weak, fatigue, anorexia, chances of weight, fever, lumps, night sweat, these all are general examination that can be included in the system review. Then comes the gastrointestinal elementary. So in gastrointestinal, the questions or the investigation what we can do is over whether the patient is having a normal diet, the appetite is fine, whether he is having any sort of vomiting or nausea, regurgitation, diarrhea, constipation, difficulty in swallowing. These all questions can be examined in your system review of GIT. Then the cardiovascular system. So the patient is having any type of chest pain, is he dyspneic, that is he is not able to breathe properly, if he is having shortness of breath, cough, palpitation, cyanosis, these all can be included in cardiovascular system. Coming to the respiratory system, again the patient can have cough, sputum discharge can be seen, breathlessness, then hemoptysis. Hemoptysis means spitting of blood along with your sputum is known as hemoptysis. Then you can have a wheezing problem or tachypnea if there is an increased respiratory rate. These all can come under respiratory system.